A woman in her 70s sat in an exam room, staring at a blood test result that made no sense. She took her blood pressure pill every morning, ate her banana, had her orange juice, and figured she was doing everything right. Every year, older adults make up more than a third of all emergency room visits for dangerous drug reactions, and once admitted, they get hospitalized at a higher rate than any other age group. Nothing on her plate looked dangerous on its own. It was what she paired it with. By the end of this video, you'll know the 5 ordinary food choices working against medications millions of people over 60 already take, and exactly what to ask your doctor before it's your test result.
Here's what changes after 60 that most people never get told outright. You're likely carrying more prescriptions than you did at 40. Your kidneys clear things out slower than they used to, even if nothing feels different day to day. And the thirst signal that once told you when to drink water gets quieter with age. Sometimes so quiet, you won't notice it's gone, until you're already behind on fluids. Adults over 60 account for more than a third of all emergency room visits for adverse drug reactions in the United States. And once admitted, they end up hospitalized at a higher rate than any other age group. Blood thinners, diabetes medication, and a handful of other common prescriptions show up again and again in those cases. Most of those hospital visits never started with a mistake anyone would call a mistake. They started with breakfast, or lunch, or a grocery list built entirely around good intentions. Let's go through the 5, in the order that matters, from the one already sitting in nearly every senior's medicine cabinet to the one that can put someone in the hospital from a single glass. The 4th one on this list is the one almost nobody thinks to call a mistake at all. Mistake 1. Blood thinner conflicts. Picture someone recovering from a stroke or a blood clot, put on a blood thinner called warfarin, and told to eat healthier. So they start eating more salads, more steamed spinach, kale smoothies a few mornings a week. Because it feels like the responsible thing to do, and for most people, it would be. Warfarin works by blocking an enzyme in your liver that activates vitamin K, and your body needs that active vitamin K to build the clotting factors that make blood clot the way it should. Leafy greens like kale, spinach, collards, and Brussels sprouts are the richest dietary source of vitamin K there is. When someone on warfarin suddenly loads up on greens, that flood of vitamin K can override the drug's effect almost overnight, and most people have no idea that's even possible. Here's where most people get the advice backwards. The danger isn't leafy greens themselves. Major heart and blood clotting guidelines tell warfarin patients to keep eating them, not cut them out. The real danger is a sudden swing in either direction. A new salad kick out of nowhere, a juice cleanse, or a week of skipped vegetables followed by a week of doubling up. Steady, consistent intake keeps the dose calibrated to the diet a doctor originally prescribed it around. When that override happens unnoticed, the blood starts clotting normally again in someone whose medication exists specifically to stop that. For a person already at risk of a second stroke or clot, that swing back toward normal clotting is exactly the outcome the prescription was written to prevent. The next mistake hides behind something else entirely. It has nothing to do with what you're eating at all. Mistake 2. Dehydration. After 60, your body holds less water than it used to at 30 or 40. Your kidneys get less efficient at conserving the water you have. But the part almost nobody explains clearly is that the thirst signal itself gets quieter with age too. Older adults often don't feel thirsty until they're already in the early stages of dehydration, which means drink when you're thirsty, fails this age group at exactly the moment it matters most. Now stack a diuretic on top of that blunted signal. Many common blood pressure and heart medications pull extra fluid out of the body on purpose, often exactly what the prescription is meant to do. Combine that with a thirst signal that shows up late, or not at all, and you get a real gap between how dehydrated someone actually is and how dehydrated they feel. That gap isn't a small problem. Dehydration ranks among the 10 most common reasons seniors are hospitalized in the United States, and researchers estimate it costs the healthcare system well over $1 billion a year in hospital stays. The fix: track water intake on a rough schedule instead of waiting for thirst to tell you what to do. And if you take any kind of diuretic, ask your doctor directly what a reasonable daily fluid target looks like for your situation. It's rarely the same number for everyone. That one builds quietly, with almost no warning until it's already serious. The next one usually starts with something people add to their food specifically to make it healthier. And it catches people off guard more than any other on this list. Mistake 3. Potassium traps. Someone on a common blood pressure medication gets told to cut back on sodium. Genuinely good advice. So they switch table salt for a potassium-based salt substitute, exactly the swap recommended almost everywhere for heart health. Blood pressure drugs called ACE inhibitors and ARBs, medications like lisinopril and losartan that millions of people over 60 take daily, work partly by reducing how much potassium your kidneys clear out. That's intentional and usually fine on its own. But stack high-potassium foods on top of that. Bananas, oranges, potatoes, coconut water, or add a potassium-based salt substitute, and blood potassium can climb into dangerous territory. Doctors call that condition hyperkalemia, and it can trigger a dangerous, irregular heartbeat. There's a documented medical case of an 88-year-old man on an ACE inhibitor who developed severe hyperkalemia after unknowingly eating a potassium-based salt substitute his family had brought him with good intentions. His potassium levels only came back down after doctors identified the substitute and stopped it. He was already inside a hospital, with monitors on him around the clock. At home, most people don't get that kind of warning before something goes wrong. Potassium itself isn't the enemy. Your body needs it, and it plays a role in nerve and muscle function that matters as you age. The danger is combining a salt substitute or supplement without knowing which blood pressure medication is already underneath it. A 5-minute question to a doctor or pharmacist is often the entire difference between a smart swap and a trip to the emergency room. That case happened to someone already watched around the clock by trained staff. The next mistake is one almost nobody thinks to call a mistake at all, because it's sold to you as the safe, easy, responsible option every time. Mistake 4. Hidden dangers in healthy foods. You reach for canned soup or sliced deli turkey because it feels like the light, sensible choice, especially on a day you don't feel like standing over a stove. Neither tastes as obviously salty as chips or fries, so it never registers as a sodium problem. One can of soup can carry over 1,000 milligrams of sodium, close to half of a common daily limit in a single bowl. Deli meat and jerky can run 500 to 800 milligrams per serving, and most people eat more than one serving without measuring. More than 70% of the sodium in the average American diet comes from processed and restaurant food, not the salt shaker on the table. That's why cutting back at mealtime barely moves the needle if the soup can, and sandwich meat in the fridge stay the same. Extra sodium makes the body hold on to more water than it should. That raises blood volume and blood pressure, forcing an already strained heart to work harder with every beat. For anyone managing heart failure or high blood pressure, that added strain is precisely what doctors are already trying to prevent with medication. The fix doesn't require giving up soup or a sandwich for good. Check the sodium line on the label and start treating the low-sodium version as the default in your pantry, not an occasional upgrade. The last mistake on this list works differently. It can put someone in the hospital from a single glass, and it connects directly back to the medicine cabinet we started with. Mistake 5. Food-drug interactions. Grapefruit at breakfast, sitting next to a statin or blood pressure pill, done for years without a problem. Right up until the one morning it doesn't. Grapefruit contains compounds called furanocoumarins that block a specific enzyme in your gut wall called CYP3A4. That enzyme's job is to break a drug down before it fully enters your bloodstream, controlling how much reaches your system. When it gets blocked, your body absorbs far more of certain medications than the dose was designed to deliver. This affects 3 statins by name: atorvastatin, simvastatin, and lovastatin. Medications a huge share of the senior population swallows every night. Certain blood pressure medications, including some calcium channel blockers, get caught up in the same interaction. Too much statin building up in the blood raises the real risk of rhabdomyolysis, a breakdown of muscle tissue that causes pain, weakness, and, in serious cases, lasting kidney damage. The blood pressure side is just as serious. Too much of an affected medication can cause a dangerous drop in blood pressure and dizziness severe enough to cause a fall, which for someone over 60 carries its own risks. None of this is a reason to fear grapefruit or citrus for the rest of your life. Not every statin is affected, and one occasional glass at brunch isn't the same as a daily habit paired with one of the drugs on that list. The fix takes about 5 minutes. A direct conversation with a pharmacist about exactly which of your prescriptions interact with grapefruit. The answer depends entirely on the specific drug you're taking. None of these 5 mistakes are about willpower, or carelessness, or eating badly. They're about ordinary food and ordinary medication colliding quietly, without anyone connecting the two out loud. Pick one of the 5 from this video, check it against what's sitting in your kitchen and medicine cabinet this week, and bring that specific combination to a pharmacist or doctor instead of guessing. Tell me in the comments which of these 5 you were already doing without realizing it. I read everyone. And if this helped you catch something you'd missed, subscribe, because the next video breaks down what else changes about how your body handles medication after 60.